We all feel down sometimes, that's normal. But how do you know if you are just having a bad few days or if you are actually clinically depressed? Are you worried about someone you know and whether he or she is clinically depressed? How close can they in fact be to suicide? Well, keep watching as I explain the criteria we use in the medical field to diagnose depression and also to grade its severity. I will also advise on how we can know whether someone is at risk of suicide or self-harm. Hi, welcome back to the channel. My name is Dr Aziz. I'm a psychology graduate of Cambridge University and also a medical doctor. The World Health Organization estimates that any one time 280 million people suffer from depression worldwide. 19% of adults worldwide report depression at some point in their lives. That's 1 in 5. So what is the actual medical diagnostic criteria that we as doctors, psychologists and psychiatrists use to diagnose depression? Well, the most universally recognized criteria in the psychiatric field is called the DSM-5. Core symptoms. Now there are 2 core symptoms of depression that we need to ask a patient about. One is low mood and the other is something called anhedonia. Anhedonia is a medical term for the inability to feel pleasure. Typical questions we may ask: during the last month, have you often been bothered by feeling down, depressed or hopeless? And secondly, do you have little interest or pleasure in doing things? Note that although we do typically ask during the last month, the criteria is to experience these symptoms most of the time for most days for at least 2 weeks for someone to be diagnosed with depression. Now if someone has at least one of the 2 core symptoms mentioned, low mood and anhedonia, we need to check for other symptoms, and they are as follows. Fatigue. Are they feeling more tired than they used to? Appetite. Has this changed, either decreased or increased? Sleep, either insomnia or hypersomnia. Respectively, these mean decreased or increased sleep. Agitation or slowness of movements. Poor concentration or decisiveness. Worthlessness or excessive or inappropriate guilt. Suicidal thoughts or acts. So if a person has a total of 5 of all of these symptoms mentioned, including at least one of the 2 core symptoms, again low mood or loss of interest, for at least 2 weeks, then that is a clinical diagnosis of depression. We also need to make sure 4 other criteria are fulfilled to come to an accurate diagnosis of depression, and they are: symptoms cause clinically significant distress or impairment in social, occupational or other important areas of functioning. Number 2, episodes are not attributable to physiological effects of a substance or another medical condition. Number 3, episodes are not better explained by schizoaffective disorder, schizophrenia, schizophreniform disorder, delusional disorder or other specified and unspecified schizophrenia spectrum and other psychotic disorders. Number 4, no history of manic or hypomanic episode. Now don't worry if you don't remember all of these. I'll signpost you to an easy questionnaire towards the end where these questions are asked, and it will tell you whether you or someone you know likely has depression or not. Depression severity. Now how do we gauge the severity of depression? The severity of depression is determined by both the number and severity of symptoms as well as the degree of functional impairment. Subthreshold depression is diagnosed if the person has at least 2 but fewer than 5 symptoms of depression. Mild depression is diagnosed if the person has few, if any, symptoms in excess of 5 symptoms and they only result in minor functional impairment. Moderate depression is diagnosed if symptoms or functional impairment are between mild and severe. Severe depression is diagnosed if the person has most symptoms and they markedly interfere with functioning. They can occur with or without psychotic symptoms. Now we mentioned earlier a possible way of assessing suicide risk and how severe the risk is. Now, unlike the diagnosis of depression, there is no universally agreed upon scale to assess suicide risk. One of the common and easily remembered ones though is called SAD persons. SAD persons scale reads as follows: S, sec. 1 if male, 0 if female. Now more females attempt suicide but more males actually succeed, which puts males at greater risk. A is for age. If they're below 20 or over 44, they're at greater risk. D is depression, so they're at higher risk of suicide if depression is present. P is previous attempt. E is ethanol abuse, i.e. alcohol abuse. R is rational thinking loss. S is social support is lacking. O is if they've made an organized plan. N is no spouse. They're at higher risk if they don't have a spouse or partner. S is sickness. If they have a chronic, debilitating and severe sickness, they are more at risk of actually committing suicide. Now what do we do after calculating the score? The total score, a guide, is as follows: 0 to 2, you can send home with follow-up to make sure that they are okay. 3 to 4, close follow-up but maybe consider hospitalization. 5 to 6, strongly consider hospitalization depending on confidence in the follow-up and arrangement. 7 to 10, we need to hospitalize or commit. Anyway, I hope you found this informative. Please only use this information as a guide, or if you're a healthcare professional, then just to brush up on the guidelines. If you have concerns, you must speak to your own doctor. Now I mentioned earlier that I'll provide a link where you can easily check whether you or a loved one may have depression. The website is called MD Calc and I'll link that down below. And don't worry, there's no spams or adverts. You don't have to sign up to anything. It's a clean website that many healthcare professionals use. Again, don't use this to make a diagnosis. If you are worried, then make sure to speak to your own doctor. Anyway, I hope you learned something useful and enjoyed this summary. If you want to keep learning about the psychology, medicine or life hacks, hit the like, subscribe and notifications button. Any suggestions or comments, feel free to post down below. Until next time, stay safe.